Welcome back, students. This is Dr. Deepthi Variku, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Science. Continuing with proprioceptive neuromuscular facilitation, which is an approach to therapeutic exercise that combines functionally based diagonal patterns of movements with techniques of neuromuscular facilitation to evoke motor responses and improve neuromuscular control and function. Talking about the PNF techniques, which we will see in the coming slides, the patterns of PNF techniques which can be used to develop muscular strength and endurance, facilitate stability, mobility, neuromuscular control, and coordinated movements. They also lay a foundation for the restoration of function. These patterns are useful throughout the rehabilitation from early phase of tissue healing when we use them as isometric techniques and in the final phase of rehabilitation when high-speed diagonal movement patterns can be performed against maximum resistance. So this is the basic thing which today we will be dealing with. Those are the patterns of the PNF. The patterns of PNF associated are composed of multi-joint, multiplanar, diagonal and rotational movements of the extremities, trunk and neck. So these patterns will be in the form of diagonal 1, diagonal 2 patterns. We will be starting with the neck patterns. The neck patterns are rotational patterns along with the contralateral patterns. So we will start with flexion, rotation to right, then extension with rotation to left, and then the rotation patterns. Now these are the neck patterns which you can see in the diagram. Now the diagonal patterns are D1 diagonal pattern and D2 diagonal pattern. So upper extremity D1 flexion extension, D2 flexion extension, same lower extremity D1 flexion extension, D2 flexion extension. So this is a basic diagram which will tell you about the diagonal patterns. If we see in this diagram, we could see that D1 flexion pattern, which is a flexion pattern with adduction and external rotation, ends up in D1 extension pattern, which is the extension abduction in internal rotation. Similar way, the D2 flexion pattern, that is the flexion abduction pattern, ends up in D2 extension pattern, that is extension adduction and internal rotation. Now, if you see this diagram, you can see that on the left hand side, we have above the flexion, below the extension. But on the left hand side, we have adductions, and if the adduction goes on up, it becomes external rotation. If the adduction goes down, it becomes internal rotation. The forearm remains constant, pronation or supination. The wrist for up goes for radial flexion and down goes for ulnar extension. Fingers are flexed in flexion of D1 and extension of D2, while fingers are extended and wrist becomes radial extension for D2 flexion and ulnar extension for D1 extension. So this is the basic patterns in which we see shoulder flexion patterns and extension patterns. Now upper extremity, one by one we will see the D1 flexion pattern. First, let us have a look about D1 flexion pattern. D1 flexion pattern keeps shoulder in flexion, adduction, external rotation. Scapula is in elevation, abduction and upward rotation. Elbow stays in flexion or extension because it is the neutral component. Forearm remains in supination. Wrist becomes in flexion and radial deviation. And fingers and thumb are in flexion and adduction. So this is the starting, you can see this is the ending position of D1 flexion. When we call the name of a position, that is the end position. So we will start off with the contralateral position. That is the starting position will be shoulder extension, abduction and internal rotation. Forearm pronation, wrist extension and ulnar deviation with fingers extended. Then you will go for the end pattern, that is the movement pattern, which is D1 flexion, which I just told you. Okay, now D1 extension pattern. D1 extension pattern will start with shoulder flexion, ulta bilkul, adduction and external rotation, forearm supination, wrist flexion and radial deviation. And now we will see what is actually D1 extension pattern. What is the end D1 extension? So while you end the D1 extension, the shoulder should be in extension, abduction and internal rotation. Scapula in depression, adduction, downward rotation. Elbow in flexion or extension. Forearm in pronation. Wrist in extension, ulnar deviation. And fingers in extension and thumb in abduction. That is the end pattern for your D1 extension. Now upper extremity D2 flexion will start with shoulder extension, adduction, internal rotation, forearm pronation, wrist flexion and ulnar deviation. Okay? And your D2 flexion of upper extremity will end with flexion of the shoulder with abduction, external rotation, elevation of the scapula, abduction of the scapula, upward rotation of the scapula, flexion or extension of the elbow as it is the neutral position, forearm in supinated position, wrist in extension and radial deviation, fingers in extension and abduction. That is end position of D2 flexion. Then D2 extension will start off with shoulder flexion and abduction. Okay, that is your actually what? The ulta of the flexion pattern. Shoulder flexion, abduction, external rotation, forearm supination, wrist extension and radial deviation, which was the last position of the previous one. And D2 extension will end when shoulder is in extension, adduction, internal rotation, scapula is in depression, adduction, downward rotation, elbow could be flexion or extension both, forearm is in pronation, wrist in flexion and ulnar deviation, and fingers and thumb in flexion and adduction. So this was the positions, diagonal patterns of the upper extremity. So this is this diagram, you could see the diagonal patterns of the lower extremity. Again, I am telling you, when I say D1 flexion, that is the ending position of the D1 flexion. So we will start off with D1 extension and end in D1 flexion. We will start off with D2 extension and end in D2 flexion. That is the basic movement patterns of the upper and lower extremity. So first pattern is D1 flexion. D1 flexion of lower extremity will start with hip in extension, abduction and internal rotation, ankles in plantar flexion, foot everted and toes flexed. While we move it from for the right side, the movements in the end position of D1 flexion will have hip in flexion, adduction and external rotation. The knees could be neutral, ankle in dorsiflexion and inversion, and toes in extension. Then next one is the D1 extension pattern. We will be starting with hip flexion, adduction and external rotation, ankle dorsiflexion, foot inversion, toe in extension. And once we cross the diagonal pattern, D1 extension pattern will be ending in hip in extension, abduction and internal rotation. Knees again could be neutral, flexion or extension. Ankle could be in plantar flexion and eversion, and toes in flexion. Next one is the lower extremity D2 flexion pattern, which will start with hip extension, adduction and external rotation, ankle plantar flexion, foot inversion and toe flexion. Okay, again we will cross the body diagonally and D2 flexion of the lower extremity will end in hip flexion, abduction and internal rotation. Knees again neutral, flexion or extension. Then ankles in dorsiflexion and eversion, and toes in extension. Then lower extremity D2 extension will start off with hip inflection, abduction and internal rotation, ankle in dorsiflexion, foot in eversion, toes in extension. D2 extension will end in extension adduction of the hip with external rotation. Again, knee in neutral, it could be flexion or extension, ankles in plantar flexion and inversion, and toes in flexion. So these are the diagonal patterns for upper extremity and lower extremity. Once again, see, this is a chart. Diagonal patterns means you have to cross the midline. You can start off with extension, adduction, internal rotation and end in flexion, abduction, external rotation. Or you could start off with flexion, adduction, external rotation and end in extension, abduction and internal rotation. Vice versa. Okay. So these are the diagonal patterns. Make sure whenever the diagonal patterns are, whenever you perform these diagonal patterns, they are performed with starting with the rotational techniques. Proximal components are kept in mind while you perform the diagonal patterns. Okay, so diagonal patterns are very important. You have to make sure the position of shoulder, hip, ankle, wrist is maintained while performing the diagonal patterns. Now after these diagonal patterns, again same thing. This is the D1 flexion. See, we are starting here and ending in D1 flexion. Elbow could be neutral. So summing up, I am showing you D1 flexion has shoulder in flexion, external rotation and adduction, wrist in radial deviation, fingers in flexion. D1 extension has shoulder in extension, internal rotation, abduction, wrist in ulnar deviation and fingers in extension. This is D1 flexion. See, this is the first diagram is D1 extension ka starting point and second one is the ending point. Then D2 flexion, shoulder in flexion, external rotation, wrist in radial deviation and extension. This first diagram A, you could see D2 flexion, and B, you could see the ending part. Next is D2 flexion pattern. See, this is again shown here. D2 extension, shoulder in extension, internal rotation, adduction, wrist in ulnar deviation and fingers in flexion. This is the last part. The B second diagram is D2. Yes. So now we move to one more thing. Those are the unilateral patterns and the bilateral patterns. Unilateral pattern means when pattern is performed only on one side of the body while the other side of the body does not perform the pattern. So unilateral D1 flexion is like hand to mouth motion, like khana khate hue, coom karte hue. Unilateral D1 extension is pushing a car door to open from the side. Unilateral D2 flexion is combing the hair on the other side. D2 extension is pitching a baseball. Okay, like see, this is, you can see here, combing. This is again a PNF pattern, opening the door. This is on the same side. And this is putting something on the opposite pocket of your pants. Okay, now the bilateral patterns. Bilateral means when you are performing both the sides of your body, right and as well as the left, are performing the PNF patterns. These patterns could be symmetrical, asymmetrical or reciprocal. Symmetrical means both the sides are performing together D1, together D2. Okay. Asymmetrical is one is performing D1, another is performing D2. And reciprocal is one side and another side. First one you see is the symmetrical patterns. You could see both the hands are performing same pattern of the upper extremity and lower extremity. Flexion pattern. Second, you see asymmetrical because the right side is performing flexion adduction, and the left side is performing flexion abduction. So again, you could see this is asymmetrical patterns. Reciprocal, you see, right side is performing the extension and left side is performing the flexion. So these are the reciprocal patterns, asymmetrical patterns, and symmetrical patterns. Now here you see one is performing D1, another is performing D2. This dancing pattern, you can see this girl, she's performing all different patterns from all the four limbs. Now, first diagram you see, it is the ipsilateral. Ipsilateral means one side of the body is performing flexion abduction on the upper extremity also and lower extremity also. Contralateral means both the hand and the leg, both upper and lower extremity are performing flexion and abduction, but not on the same side, but on the opposite side. Leg on the right and arm on the left. So this is contralateral. Diagonal, you can see here, see one is diagonal. See, diagonal could be symmetrical, diagonal could be asymmetrical, diagonal could be reciprocal. Here what we see is diagonal reciprocal movements. Now I think you understand this diagonal reciprocal movements. These are the bilateral movements performed by the lady. These are bilateral asymmetrical movements because one hand is performing D1 and another is performing D2. So now we will see about the lower limb patterns. Same way, the hip, if flexion adduction, external rotation, ankle goes for dorsiflexion inversion and toes for extension. This is D1 flexion pattern. See, here the end movement is the D1 flexion pattern. D1 extension is extension abduction internal rotation with ankles in plantar flexion, eversion and toes in flexion. See, the second part is the D1 extension pattern. You start off with the opposite pattern always. So, D2 flexion pattern, flexion abduction, internal rotation, ankles in dorsiflexion eversion and toes in extension. This is the end part. The second diagram is the end part and first one is the initiating part. D2 extension pattern, hip in extension adduction, external rotation, ankle in plantar flexion inversion and toes in flexion. Okay, so the first one is the initial position and second one is the last position, the basic position of D2 extension pattern. Now moving to the trunk patterns. See, these are the trunk patterns. You could see chopping, like you chop something. You take an axe and try to chop something. The movement you perform while chopping is a diagonal movement. For example, you are a right-handed person, you are chopping, you start from your arms in full flexion and start from right side and chop towards the left side. That makes your trunk to diagonally move from right to left. Then lifting, you can see coming back. Chopping के बाद उल्टा वापस उठना is the lifting, which again performs the diagonal movement. You see, this could be with knee straight also. Like here you can see the therapist helping the patient to perform the trunk PNF patterns. PNF could be used in other areas also, like intrinsic muscles of eyes, tongue muscles, facial muscles, like breathing, swallowing, speech. Okay, all these things, all here could be used. Furthermore, there are patterns specially for the scapula or pelvis and techniques that integrate diagonal movements into functional activities, like rolling, crawling, walking. There are several in-depth resources that describe and illustrate the many variations and applications of PNF. हम बहुत जगह इसको we could use it in various things, in various techniques. It could be used, the PNF technique. Uses of these PNF techniques as well as other Associated PNF techniques could give the therapist a significant variety of manual resistance exercise techniques to increase muscle strength or relax the muscles, or to promote dynamic stability and controlled mobility as the foundation of and in preparation of the initiating task specific skilled movements in a rehabilitation program. I hope you understood about the PNF techniques. These are few books which you could refer in your libraries and read about the PNF. I think it was enough, and now you could answer about the diagonal patterns of PNF. Thank you so much. Thank you all.